So, heart problems, first of all, let's have a look at those. Now, probably one of the most major things that we can consider here is cardiac failure. Now, you know anything cardio is to do with the heart. So, cardiac failure. So basically what we're talking about is failure of the myocardium. It can't keep up with the demands of the circulation. Okay? It's failing. And there are two forms of cardiac failure that we can think about, that we can consider: acute and chronic. And we need to consider each in turn. So we'll take acute first of all. So acute cardiac failure. And there are generally two outcomes of acute cardiac failure. The first of these is death, if it's severe enough. And the second is recovery and some degree of impaired heart function. And it may even be, it needn't necessarily be, but it may even be that this impaired heart function is actually chronic failure. So they switch from acute failure into chronic failure because of a certain level of the heart tissue which has died and is suffering in some way. Okay? Now we need to think about the various things that can cause acute cardiac failure. First of all, a chamber may rupture. And if a chamber is going to rupture, it's usually a ventricle. Now, the person may have been 100% fit and well beforehand. This sort of thing is usually the result of some sort of defect within the structure of the heart itself, which may not be detected until it actually goes. And ventricular rupturing is the sort of thing that we see with them. You know, you read these reports every now and again of 21, 22-year-old, very fit young man, plays for his local football team, suddenly drops dead on the pitch. It's that type of thing. Okay? So there was probably some sort of underlying deformity or malformation of the ventricle wall to begin with. It's been fine and dandy for most of his life, but at that particular point in time, the activity, the size of the body as a grown man, the pressures and so on exerted on it, just causes it to go.